You're listening to The Artist Athlete, episode 7.5. I'm Ron Burgundy. Hey friends, fans, and enemies. I'm Shannon McKenna, and I'm the host of the Artist Athlete podcast. This podcast is dedicated to circus. It's a resource for those working in the industry to share our stories, viewpoints, and information, and it's a place for outsiders to get a sneak peek into our world. Today's episode is part 2 of the interview I did with Dr. Jen Crane of Cirque Physio. If this is your first time listening to the show, hey, welcome. Thanks for tuning in. I'm about to start smack dab in the middle of a conversation, so it may be a little confusing for you. I recommend going back, downloading, and listening to episode 7, and then 7.5 will make a lot more sense. And after you do that, subscribe, rate, and review on iTunes. So, let's get to it. Here's part 2. Something that everybody is asking about is this like end range flexibility and like middle splits or shoulders, that like I'm stretching, but I just haven't gone anywhere in a year or something. Can you test for that place where people just stop without getting an MRI?
Oh, like what is structural versus, you kind of, not realistically. You can't realistically test for if it's structural versus something that you just are training maybe inefficiently. So usually what I will tell people when they ask this question is, yes, there are some people who just cannot achieve flat middle splits. But I think that is a much lower percentage of us than we often think. And many times we're just not training in the most efficient way that takes into account all of the potential structures that limit flexibility. So there are we all think that muscles are the only thing that limit flexibility, and we just need to passively stretch and hold, and then we will get more flexible, but that's not the case. You have to think about what are the demands of your apparatus? Why are you training flexibility? Do you need active flexibility? And then of course, what other structures might be limiting that? So there's nerve tension, there is joint mobility within, the hip joint if we're talking about middle splits or square splits. There are all these things that people might think that it's a structural issue for them, that they can't break past that, but really it's just that they haven't realized that the structure that's limiting flexibility for them is not the muscle. And I think what the common thing that happens is people will stretch for a length of time, and then, like you said, they hit a plateau, and then they don't progress because they've reached kind of the ceiling effect of, with their available joint range of motion, how much is the muscle limiting that? So they hit the end of that, and then they don't address the next thing that's limiting their flexibility, whether it be nerve tension or joint mobility or whatever. So which is what that's what I talk about a lot, is this concept of figuring out what's limiting your flexibility and then addressing that. And
it's like leveling up and unlocking these things.
Exactly.
Right? Like you do this one thing and it like levels you up to a certain amount of flexibility.
Right.
And then it sounds like have to change or address something else, or like beat a new boss before you can level up to the next flexibility.
Exactly.
Would you say it would be an apt metaphor?
That's a very apt metaphor. Yeah. We in physio we call it the receding waters effect, but I like that one a little bit.
Waters effect.
And it's kind of right. It's kind of this idea of you work on one thing, and then as that thing improves, the waters recede, and this new thing becomes visible that is then the limiting factor, whether it be in injury management or in flexibility. So you can apply this to a lot of different things. So you just have to always be looking for what is the current thing limiting your flexibility, and how do I address that? And I think that's...
I see this in strength and skill training also.
Definitely.
You have like one thing and you're like, oh, I've worked on my lower abs so much. Why can't I still not invert? And it's like, well, your lats are teeny tiny. So let's work on sure.
It's the same thing.
Receding water effect.
Receding waters effect. Yeah. I think it's just the thought of applying critical thinking to whatever you're doing. Yeah. And there's not one recipe for everybody. And recognizing and addressing that is important.
So if you are one of these people who it's just like structural for, are there surgeries available to like you know, like maybe tighten up the eyes and like push out the lips and like flatten out the middle splits, or like I've heard of, there was a rumor going around about this contortionist a while ago that she had ribs removed to be more flexible. Is that actually something that could help?
I don't think that's something in the U.S. that could help. I don't think that's really available.
Like you couldn't get cosmetic surgery for flexibility.
Oh man, I don't think that that's an option. From what I've heard, maybe there's like a black market that you can look into, or go to Mexico, Thailand, China. Maybe they can offer some surgical options that we.
But would they help? Like, would that do ribs inhibit back bends, or does
ligaments inhibit back bends, but we don't go and cut those out. I would say that person that is looking for the surgery probably needs to have a different conversation with a qualified healthcare provider, maybe more concerning their approach and thought process to.
Jen, I'm fine.
Shannon, it's okay.
There's nothing wrong with me.
Okay.
I just think a little bit more and then just a little bit more, and I'd be good.
Yeah, I'll look into that for you.
Thanks, girl.
Yeah.
Appreciate it.
I got you.
My next question, or someone asked, aging. So you see people who maybe are an aerialist, and so you treat them one way, or their flexibility or contortion is their goal, you treat them another way. Do you also look at their age when you're treating them, and how do you take that into account?
Sure. Yeah, I think that that's a really, really important thing to consider as circus arts become much more recreational. And then the older population can also, this is can be very accessible. But then what people run into is when they're older and then starting to work on flexibility is, their progress is a little slower.
Yeah.
And I think that when you're working with, really anyone over age 25, I think, which depending on when you started circus may be considered old or not. But yeah, I think that the things to consider when working with older circus artists for flexibility is just the amount of time that it's going to take to improve. Yeah. And then also a lot of the flexibility, kind of like your flexibility prognosis, comes back to genetics and what you did growing up as a child. And those are the two main things that I think impact flexibility the most. And researchers have uncovered this kind of what they call a flexibility gene, which is part of our DNA that actually determines if you trend towards more flexibility than the average human being. So genetics play a huge role.
And that's true regardless of age.
Interesting. There's a sliding scale, of course. So
sure.
I think when you're older, if you have that gene, you will progress a little more quickly than someone who is your same age without that gene, or without that trend towards hypermobility. But I think that, anyone at any age can improve flexibility. But you don't have the luxury of just slamming into a stretch and holding it for 5 minutes when you're an older circus artist.
Nor do you have the time.
Nor do you have the time. Yeah. So it's just, I think you just have to be a little bit more conscious about that and really attack it more with a better approach, I think. So, but yeah.
What about in regards to strength building?
Yeah.
Or skill training?
Sure. So it is harder to gain muscle mass as you age, especially for women, but it's still possible. But then again, you just have to be a little bit smarter about it. Then you have to start thinking about nutrition and is there enough protein in your diet and the timing of that, and that you have to think of the whole. You have to be much more well-rounded with it than you could be if you were younger. So I think generally the trend that I see is you can still very much improve strength and flexibility as you age, but you have to have a smarter plan of attack and you have to be a bit more patient.
What is a day in the life of Jen Crane, Dr. Jen Crane, when she's not gallivanting across Europe?
I was going to say right now.
No. Wake up, eat a chocolate croissant, have a coffee.
Go find some coffee.
No, but so how much of your work is seeing patients now? How much is your own training? How much is spent doing research and continuing your own education?
Sure.
How do you balance your life between all the things you do?
Yeah, that's something that is always a struggle, right?
Totally.
Balancing your life in a way that you want it to look. But I think that I'm really lucky because I do work for myself. So I can schedule my day and my week however I would like, which tends to look like me scheduling patient care around my training. So we all have our preferred training time throughout the day.
Yeah.
I'm much more of a morning, afternoon exerciser. So I'll usually block out my mornings and afternoons for training and then admin work. So I work with a lot of circus artists remotely, whether it's via Skype or doing various online intensives or just working on the different curriculum for my flexibility courses. So I do all the computer work, admin, or my training in the morning and afternoon. And then I see patients in the afternoon and evening 3 or 4 days a week when I'm in San Francisco. So if you look at my caseload with like my patient care per week, it's probably about half of a normal physio.
Wow.
Which is really important to me because the burnout rate for physios in the US is so high because most physio clinics take insurance. And when you take insurance, you have to play by insurance's rules and regulations. And that means you have to see a lot of patients every day. I know physios that see 20 patients a day.
Wow.
I probably see 20 patients a week, maybe less. So for me, I chose not to take insurance and to go out of network because also insurance companies they don't care if you can do a straight arm inversion. They care if you can get up and function as a normal human being. So they're not going to pay for circus physio. And then that also allows me to see patients one-on-one for longer. So everyone I am with for at least an hour. So because of that, because of the time intensity and the nature of the way that I treat and work with patients, I limit my visits per week for, just because that seems to work best for me, and makes me the happiest because I still get to work with patients and work with circus artists, but I don't burn out so quickly.
Yeah.
So yeah, I think it looks like 15 to 20 hours of patient care and then mornings and afternoons doing computer work or training or whatever. But yeah, I was pretty purposeful when I was setting up my schedule in San Francisco because especially when you're self-employed, it's very easy to go overboard, as you know.
Totally. Yeah, I always joke like right now, like my boss is me and she's such a pain in the ass.
Yeah, my boss is too.
Slave driver.
Seriously.
Horrible.
No time off.
None.
No paid time off.
No.
Ugh. What are you
Calls in
gonna
the
do?
middle of the night.
Right?
Freaks out about stuff that's not important. Always.
Fine.
I want to talk about, like aside from your physio work, you have a huge online presence and you have so many resources for people to access.
Yeah, absolutely. So when I started out online on Instagram, really the only reason that I think I have an online presence at all is because I was stuck in China for 8 months watching a lot of weightlifting practice or diving practice or ping pong practice and had all this time on my hands. So when I was there, I was thinking like, how can I still work with circus artists even though I'm not in America? So that's how I created my blog. And then once I created my blog, my blog is a really great place to go for free resources on basic, like the very foundational questions that a lot of circus artists ask and don't know the answer to or don't know how to find the answer. So I talk about shoulder pain, back pain.
You're piking like a Chinese diver article. I think probably like 40% of the people who I train have read that article.
That's awesome. Yeah. It's crazy. The internet is crazy. It's
amazing.
Crazy to me. Yeah. So all of these kind of very foundational ideas that I think all circus artists need to know, that's what my blog has. So that's a really great free resource for people to answer more in-depth questions. So these are pretty lengthy posts, but they are written in such a way that anyone with any level of education can understand them. That's very important to me because you see a lot of these people going around online or like on Instagram or on their blogs or whatever and their products that they're selling, and it's just all jargon and it's all biomechanics.
Yeah, and I don't, as a coach, like I look at outcomes and I look at people achieving their goals and I'm not necessarily interested in what exact muscle does this exact thing at this exact time except for to achieve that outcome.
Yeah. And I think that this is where a lot of pseudoscience starts floating around Instagram and the circus online world is that you see people who are kind of spewing all this biomechanic anatomical jargon, and you don't understand, the average circus artist doesn't understand what it means or what implications it has. And then it's just confusing and not helpful. So that's something that I feel really strongly about. And I try to gear all of my Instagram posts, social media posts.
And I think that's why you've been so successful too, is because you're really good at distilling the information and bringing it to people so that it's practical.
Yeah, that's because the thing is, like, I want to answer people's questions and I want people to understand all of these different components of flexibility and strength training and injury prevention. And to do that, if that's my goal, which it is, I have to speak their language. Mm-hmm. I can speak physio language. I can speak medical terminology, but I can also speak circus artist. And I think that connecting the two is really important. And that's a really big belief of mine, that everything should be very achievable and understandable by anyone. So yeah, that's how all of my Instagram posts and blog posts are written. And then I also have my online.
You have the ebooks.
Yes, the ebooks.
They're courses.
How
are they set up?
They're ebooks. So they're different programs that are in an ebook style that go through different foundational flexibility positions. So I have back bending for upper back and shoulders, back bending for low back and hips, and then active leg flexibility. And these are all active flexibility programs that are meant to supplement a current stretching program. So I'm very clear about that because I don't want people buying it thinking it's like a follow along flexibility video, because it's not. And what it is it's for people who kind of have hit that flexibility plateau, or there's a huge gap between active and passive flexibility and they want to bridge that gap. And the ebooks are all structured in such a way. The series is called The Science Behind the Art of Active Flexibility. So I really want to teach people the concepts behind this and the theory and why it's also an exercise program. So it's like a whole format of exercises to do and how many sets and reps and all of that. But I want people to understand why they're doing it.
Yeah.
And the why behind it. Because if you teach people that, then they can apply that to their training as well. And that's really valuable to me, to teach people that. So, but yeah, it's a manual of all of the different exercises that are broken down into different sections that talk about nerve glides, this active release concept with the peanut or lacrosse ball, and then different rotational exercises and end range control exercises. So it's all this stuff that I've seen in my time in the circus world. You see patterns and you see how most people stretch and you see these gaps. And it basically is meant to fill those gaps from more of a medical standpoint in a way that also can prevent injuries, the common injuries that I see in circus. So that's how the ebooks are set up. And then of course in the manual, it has photos and descriptions of all the exercises, but then there are links to the full videos. So that's the setup of those. And then I also have a company with Katie Breyer, who's a contortion coach, who is fabulous. She's my contortion coach.
Yeah, she needs to come on the show.
And I love her a lot.
Sure.
Yep. So we have a company called PhysioFlex where we kind of combine what she does as a flexibility and contortion coach and what I do as kind of a physio injury prevention active flexibility standpoint. So we put that together in a full program that's in an online course. So it's a different format. It's a self-paced online course that people can go through and kind of learn. It has the same theory approach. So we talk about why you do the exercises, what potential structures limit flexibility, and how our program addresses that. So that's what the PhysioFlex programs are. And then, I think that's all I have right now. I'm working on this new.
And you also helped a lot with my manual, which is the super practical way of hanging upside down.
Yes.
And aerial alignment.
Yes.
And did a great job, because I also think it's really important to have accessible, approachable resources that don't have a bunch of medical jargon in it.
Right.
And I knew I could come to you and you could be this person who says, this is why it works. I am fully qualified to talk about this, but I'm going to talk about it in a way that you can understand and is applicable to exactly what you're doing.
Right. I was just so excited when you wanted to write this manual. I was like, you need to, because your writing style is great and I love it. And also, like, you were my first straps coach. So I think that was really great, because I know that your techniques are great and they work. So yeah.
Thanks, man.
I love it. I love it all.
This podcast is brought to you by The Artist Athlete. Did you know that The Artist Athlete is more than just a podcast? It's a growing online resource for students of the aerial arts to deepen their journey to badassery by accessing techniques approved by physical therapists and master coaches in the industry. Our current spotlight is on the fundamentals of aerial alignment, a practical manual for hanging upside down. This online manual is a step-by-step guide. It is complete with photos, videos, and exercises that you can implement immediately to help you gain the strength and awareness you need for an aerial practice that promotes shoulder health and longevity and good posture upright, so you don't walk around like a gorilla. But don't just take my word for it. Here's circus physical therapist Dr. Jen Crane of Cirque Physio to tell you more.
The fundamentals of aerial alignment is an absolute must-have for every aerialist of every level. I can't even tell you how many shoulder injuries I treat that are a direct result of rushing past the basics in an attempt to get a trick too soon. In the manual, Shannon deconstructs the fundamentals, including the correct muscular engagement to safely arrive in these positions and the rationale for why it matters. Of course, in addition to all of these fabulous pearls of wisdom, the book is also ridiculously fun to read. It's been lovingly garnished with the Shannon humor we all know and love.
Thanks, Jen. Cirque Physio is also featured in the book to give scientific insight into why it all works. Pick up your copy today by going to theartistathlete.com and clicking e-manuals. Listeners of the podcast can get a 10% discount by typing in the offer code PODCAST at checkout. Again, that's theartistathlete.com, offer code PODCAST. Now, back to the show. What advice would you give to yourself, not at the beginning of your physical therapist career, because I feel like that advice would obviously be like, do circus immediately.
Do circus. I don't think it would actually.
Really?
Yeah.
So at the beginning of your PT career, what advice would you give yourself?
I think the advice that I would give myself is, and something that I've done throughout my career, which I think has really, in retrospect, has served me very well, is that if I saw an opportunity for something that I wanted, even if it seemed like it was out of reach for me, or if it, they asked for 5 years of experience and I had 3 or something like that, I always would just go for it. And I think that that's something that women in healthcare and just women in general really don't do. But I was really lucky enough to have a lot of awesome women in my physio life that were great mentors and role models for me.
Cool.
So, but I this was always accompanied with a lot of anxiety and stress. So I think I would just tell myself.
This is true in circus artists too. I find myself when I see like audition posts or things like that, where they're like, we need a aerialist, but who can also tumble and do rollerbola and this, and this. And It's like, well, and I finally realized like you have to send your stuff in anyway because they don't see you. And if they like you, they're going to take you.
Yeah,
for
exactly
who you are,
and
not for what they think they want already.
And there's a lot of value in you as who you are. And I think that that was something that I didn't realize for a little bit. Mm-hmm. And I think that that's really valuable to know that even if you don't fit all of their 10 laundry list of things that they want, it's still valuable to try. And I think that that is something that gave me cool opportunities because I did that, but I was also really stressed and anxious about doing it. So that was something that I would encourage myself to do. And then also to be discerning with what I commit to. Because I have a hard time saying no to people. And that, especially in my early career, I saw an article once that it was basically like, is it a hell yes? And if not, then don't do it. And that's something that I find is very true for myself, that if someone presents me with an opportunity or I see an opportunity, and if my gut reaction isn't like, oh my God, I need to do that, then I probably shouldn't do it. So that's a piece of advice that I would definitely give myself.
Is it a hell yes?
Is it a hell yes? If not, probably don't spend your time on it.
All right. So I've got some other really important questions for you. Would you rather... Would you rather be able to speak to every person in the world, like be able to speak to every language, or be able to speak with your favorite species of animal?
Oh my God, that's such a hard question.
I told you it was hard hitting, man.
Oh man, that's brutal. I think I would rather speak to
I used to have this question be, would you rather speak to all animals or all humans?
Oh, okay.
But I feel like that one is like, obviously you'd rather speak to all animals.
Obviously.
But if you could only pick like one species of animal,
okay,
that you could speak to all of that species or all like human species people.
Yeah. I think I would rather speak every language, actually. Because, of course, my mind immediately goes to my dog, Bella. And I would love to speak to Bella.
But you like already speak to Bella,
yeah, that's the thing.
I feel like.
We already have a really good communication connection. So I feel like we don't need verbal words with us. So yeah, but I think that'd be awesome. Because obviously when you travel, it would be great to just be able to speak every language.
Yeah, awesome. To know what you're ordering off a menu.
Oh, that would be ideal.
So good.
That would have saved me a lot of stomachache in China.
What's the weirdest thing you ate in China? Or like the thing that was strangest to you?
Oh, gosh. I don't think I actually know what the strangest thing I ate was because I never knew what I was eating.
Yeah.
I mean, if I had to pick something that I knew was a thing that I ate, it was the brain of some animal. I want to say maybe a duck. Oh, I did eat a duck tongue, which was probably the most disgusting thing that I ate there. A duck tongue? A duck tongue. And there's this long sliver of cartilage down the middle of a duck tongue, which I learned after the fact you don't eat. But I was at dinner. So how it worked in China, when you started working with a new team, the coaches would take you out to dinner, and they would get to know you and just your approach, and you would like drink with them, and it was like this whole social event. So I was out with the weightlifting team, or the weightlifting coaches, and they ordered duck tongue, and they put it in front of me. And I was like, okay, cool. And it's kind of like a show of, yeah, I can eat this. I got this.
Yeah.
And so I before anybody else ate their duck tongue, which was my first error, I grabbed the duck tongue with my chopsticks and just chomped into it. And immediately I felt this crunching. And I was like, huh, so do I continue eating this? Which I did. So yeah, I ate it, chewed it, swallowed it. And then I turned to my translator, who was there luckily next to me, and I was like, I don't eat the whole thing, do I? And he goes, no, you eat around the cartilage bone in the middle. So that was pretty gross.
That's really gross. Would you rather stay in one place for the rest of your life or move places, but you have to move every month? So you can never live in the same place for more than once in your life.
Can I live in the same town in different places?
No.
When can I go back to the town?
You can't, ever.
Ever?
Yeah.
Ooh. Can I bring my dog?
Yeah, I'll allow it. But no other people.
No other people?
Yeah.
The thought of staying in one place for the rest of my life terrifies me.
It's terrifying, right?
So I think I would have to choose somewhere new every month with Bella.
Mm-hmm.
Yeah.
Yeah. Mm-hmm. Me too.
With Bella?
These are all based on, totally with, of course. She's adorable.
Right. She's the best.
These are all based on, I taught at Circus Smirkus one summer, and the coaches all had to eat with the campers, and I had no idea what to talk to these kids about other than circus. So I came up with all these weird, would you rather questions, and we would have one every day where we would talk about them. And these are my favorite ones.
That's awesome. I like that a lot.
And the other one I have is, would you rather have the same clothes a cartoon character, just wear the same clothes every single day for the rest of your life? Mm-hmm. You have one outfit.
Okay.
Ever. Mm-hmm. Or, unless you're performing or something, then
sure.
I guess you get a costume.
Okay.
Or, I don't know. Or actually even better, no, you just get one outfit for the rest of your life.
Okay.
Or you have to change outfits every day. So you can never wear the same thing twice.
I mean, I don't think I would really. Honestly, I think either would be totally fine with me because I feel anyways I wear the same iteration of outfit most days. So that wouldn't really bother me. But then also changing outfits every day, I mean, I wouldn't have to pay for them, right?
That's true.
So I don't really care. So I'd probably change outfits every day. Yeah. I think. I could go either way.
I know. Yeah. I really like the Steve Jobs approach of just having the same thing that you don't have to think. It's just one less decision you have to make.
Yeah. Yeah.
But
I like that. If I didn't have to think about the outfit, if it was just given to me, then I would do that.
Yeah, I think in the stipulation though that's not how it works. You have to pick it out every day.
It's a lot of decision.
I know. But how fun would that be?
It could be fun, yeah.
Super creative with it.
I think I would. Yeah, that sounds fun. I could do that.
Sweet. Well, those are my only would you rather questions.
Awesome.
Like a 3.
I enjoyed those.
Yeah. Sweet. Well, thanks for coming on the show. Do you have any other last words or anything else that you get asked a lot, or questions or things you want to distill or dispel right now? Distill isn't the proper use of that word, but you know what I mean.
I do know what you mean.
Good.
I don't think so. I feel like we covered a really entertaining variety of conversations today. So I'm pretty happy with that. Yeah.
Sweet. Thanks for coming on the show.
Yay. Thanks for having me.
You're welcome. Awesome. Now let's go train.
Let's go explore Belgium.
Oh, yeah. Need more fries.
More fries.
And then we did. Friends, fans, and enemies, we ate all of the Belgian fries. That interview really went all over the place, didn't it? I want to rein it in a little bit and just do a quick recap. The first question was about testing for anatomical blocks and flexibilities. An example would be a person whose pelvis is shaped in such a way that it literally makes it anatomically impossible for them to do a middle split. So something about their basic structure is inhibiting their flexibility. And Jen's answer led to a question or a discussion about plateaus, not just in flexibility, but strength and skill training as well. Usually when progress stops, it's frustrating. And in that frustration, there's this urge to blame something that's outside of our control, right? Because if it's outside of our control, then we don't have to work on it anymore. We just say, well, I'm never going to get that, so on to the next thing. But most of the time, that plateau just means that you've gone as far as you can go until you start addressing a different limiting factor. And your job as the person with the goal is to, instead of giving up, finding out what that new limiting factor is. And sometimes that does take a while to find out. I can think of so many times that this happened in my own training. I remember when I was at the New England Center for Circus Arts that first year, I was working my ass off, and for some reason, I just was not getting stronger. I couldn't figure out why. And I was telling my coach this one day, and she asked me, "What are you eating?" And I had, at that point, been a vegetarian for the past 14 years, and she suggested I try eating meat. After I incorporated more animal protein into my diet, I saw dramatic gains in not only my strength, actually, but also my flexibility. I really want to be clear that I'm not trying to say that everyone who struggles with their pull-ups needs to go out and eat a hamburger. I'm illustrating a different example of what Jen called the receding waters effect, also known as beating a new boss. It's this concept that as you reach high levels, there are less obvious factors that may need to be addressed for progress to continue. But progress is still possible, so don't give up. Get curious. And also, apparently, surgery is not an option. Jen also addressed aging. According to Jen, anyone of any age can improve flexibility and strength, but the way you go about as you age is slightly different. I probably should have pushed her a little bit more on this topic to find out how training should change over time. But next week on the podcast, I will have Philip Tigris, who is a professional contortionist and also 40 years old. And he gives some great insights on how he has made adjustments over time based on his age. So make sure you listen up for that. Back to Jen. Then we cheesed out for a while about being entrepreneurs. And finally, Jen gave some amazing advice. And that was, if there's something you want, you have to go for it. Even if it's a bit scary and anxiety producing and you don't quite know yet how you're going to get it done or feel like you have all of the qualifications to do it, you have to go for it. You are valuable and your skill set is valuable. And part of going for what you want is acknowledging that value. Again, to put my own personal spin on it, I started this podcast still kind of feeling completely unqualified. I don't know how the audio works half the time. I'm totally winging it. I'm calling up these people and asking them questions, and I don't know if I'm asking the right ones or who's going to listen. But I'm really enjoying the process of learning. And I think if I had waited until I had all the information or waited until I felt fully qualified to do it, I would never have started this podcast. So if you want something, go out and get it. And you guys seem to like it. I have a bunch of really great reviews, and I want to give a shout out to some of the people who left those reviews. Nikantos says, "My husband and I listen to all your episodes. Living on an island keeps us isolated from what's going on in the aerial community. Thank you so much. Keep it up." Rise Aerial Dance says, "Shannon, you have made my day. I enjoyed the rigging episode because it validated a lot of the points that I have been leaning toward. I feel comfortable doing my own rigging because of the background I have in outdoor rec and risk management and the research I've done myself as an aerialist. Yet it always seemed taboo or looked down upon to proceed without a, quote, professional rigger. I'm glad to hear Brett's take on it. Great podcast, really great topic of discussion. I'm stoked to hear more." Yeah, so thanks, guys. A lot of you have been responding really well to episode 1, Brett's interview, and I'm definitely going to have another rigger on the show in a couple more episodes, so look forward to that. If you like the show, please subscribe, rate, review on iTunes. Maybe I'll give you a shout out. You can also find me on Instagram at _artist_athlete and online at www.theartistathlete.com. I also just started a Facebook group called Friends of the Artist Athlete Podcast, and from time to time I'll ask questions on that group to get you guys feedback and opinions a little quicker than I would otherwise. And that's all I've got. Thanks for tuning in this week. Make sure to tell all your friends, fans, and enemies. And I'll catch you next time. Ugh, I need that catchphrase, guys. It's really, I gotta get it.